Julie Dalton, and I'm chair of the Devon and Cornwall Community Watch Association. Well, DACWA itself is the force association that covers all of Devon and Cornwall, and my role and the role of the board is to look at the strategic changing in policing, how we fit in, that sort of thing. So Neighbourhood Watch can be about many things. Obviously, first and foremost, we talk about crime and helping people to keep themselves and their families and their communities safe. But it's also about being part of the problem-solving process. So rather than shouting about issues in the community, actually come up with solutions, work with the organisations like the police, like the council and whoever, to come up with some ideas for solving those problems and taking some ownership.
I am Eileen Deacon and I am the office manager for Torbay Neighbourhood Watch. The first case scheme began almost 7 years ago because of all the cuts. Before the cuts, we could always get a door chain for somebody elderly or who had been a victim of crime. You could get a lock or a bolt for somebody who was unsafe at home. But with when the cuts came along, of course, all that stopped. So we felt that we ought to be doing something ourselves to fill that gap. And we were going to it was just going to be a door chain scheme. But our support manager at that time, Lou Costin, she was a member of the Police Vulnerability Forum, and they had discovered that by spending a very small amount of money, they could improve vulnerable people's lives.
Hello, I'm Paul Morgan. I'm an inspector in the Prevention Department and cover prevention and communities. You see now, Neighbourhood Watch schemes give us an opportunity to actually spread a message, spread a professional curiosity message really, where we're trying to involve them with modern slavery issues, we're trying to involve them around some of the dangers of child sexual exploitation and some of the warning signs. And we're also looking for, I suppose, active members of communities. So you're looking for people who are prepared to go and do, as well as just receive some information. One of the biggest targets that was identified for the health service for the next 40 years has been an onset of loneliness and the impact that has. They recognise how vulnerable that makes people. Vulnerable people equal potential victims, and so we need to get really close in thinking with how can we make sure that the community groups such as Neighbourhood Watch, how do they ensure their local communities are as well connected and as strong as they can be to protect against that type of vulnerability. So there's more to it than just crime and crime prevention. It's also about recognising that broader view and that broader contribution that watch schemes can make.